Can you and should you always trust your doctor? That's what we're going to cover in today's video. Now, I know that's kind of a controversial question. And again, I like to remind you, I'm not a doctor, I'm not a scientist. I am an integrative health coach, and you can get all of my data and research that I've done at citations.lowertoxiclife.com. Now, here's the thing. Your doctor is a great resource and potential partner in your health and wellness journey. And it's really important that you keep that in mind because your doctor is not your boss and you don't want to put them fully in charge of everything. You want to empower yourself to do the best that you can, to do your own research, to ask good questions, to test, to try, and to be your best advocate for your health. So with that said, should you blindly believe and follow everything your doctor says? Now, here's a funny thing. Some research was done and it was found that a white male in a white lab coat was the most highly regarded, respected authoritarian in terms of a symbol that's out there. We tend to see a doctor in a lab coat, even though they don't really wear those anymore. They mostly wear scrubs, and we immediately assume expert. Now, here's the thing. And again, I don't want to take anything away from them. I'm the type of person, if I have an acute situation, I've had a heart attack, a stroke, I've had a car accident or something that requires right now immediate, potentially life or death situations, absolutely take me to the doctor. But if I start experiencing something chronic, I'm going to want to explore lifestyle choices first before a surgery, a prescription, or anything that invades my body. In today's environment, doctors under 40, we know now, are largely educated on big pharma. Medical schools receive somewhere around 50%, give or take, of their funding from pharmaceutical companies. And so what is it that you think is infiltrating what they learn? They are learned to treat symptoms, that there's a drug for that, a prescription for that, or an operation or a surgery. When you think about it, how does a surgeon get paid? When you go to see a surgeon, now I'm not trying to pretend that they have evil intention, but they're trained to remove anything that's causing you issue, and they get paid based on surgery, okay, procedures, all that type stuff. Now, consider how many times, if you want to really think about this, consider how many times an antibiotic prescription is written and given for a virus. Today, if you take a child or you go to the doctor and you have a cough, you have this, whatever, quite often you're going to walk out of there with a prescription. But here's the thing. Antibiotics do not treat viruses such as colds, flus, and most coughs and chest infections. But doctors are trained to often give parents especially what they want. Give them something to where they can tell daycare or the school, my kid's on this, and they're getting better. But is that truly the case? Now, if you talk to your doctor about diet and nutrition, right? How often do you see that? If you see a new diet or you see an exercise program or whatever, it typically says, please consult your physician first. But have you ever talked to your doctor about diet and nutrition? Most doctors will report receiving somewhere between 5 hours on nutrition, which is typically the food pyramid, which that's sad, the standard American diet, or they got one semester class, or they got no training whatsoever on diet or nutrition. But doesn't it seem logical that garbage in, the food that we ingest, is going to create the output that we have physically, garbage out, how we feel? Now, I am going to recite from a couple of my favorites, Dr. Robert Pearl, who is the former CEO of Kaiser Permanente. Okay, he wrote the book Mistreated, and he wrote the book Uncaring. Now, interestingly, he has a story in here that doctors, and I've heard this before, doctors are the highest profession of suicide. They have a lot on their shoulders. Sam, the gentleman, the doctor in the Kaiser network, names have been changed, really, they had no clue that it was coming. He had worked with him on and off, and Sam was super concerned about performance reports and statistics, and he was having a lot of stress and ultimately committed suicide. When you think about the stress that doctors are under, not only to learn and get their medical degree and then pay off all those student loans, which typically rack up, And then also provide good care. I think most doctors go into the profession to provide good quality care. Unfortunately, all the bureaucratic tape that they go through insurance companies and HMOs and medical boards and all of that, today a doctor gets an average of about 15 minutes with a patient. And if you've gone to the doctor recently, you know that. How much time do they really spend with you learning about you as a whole person? How are you sleeping? What's going on in your life? Are you under stress? What is your normal diet and nutritionary guidelines for yourself consists of? I recently ran into that. I went to have my blood panels done. I do that on an annual basis. They came back and everybody says the same thing. Wow, you are metabolically fit and you're about 12 years biologically younger than your age, etc. But the last time she said to me, well, your cholesterol is a little bit more on the higher side, so just cut back your fat. Now, the interesting thing is she had never asked me one thing about my diet. What if I wasn't even eating fat? Because dietary fat and cholesterol, your dietary intake and cholesterol, it's been proven that those two have nothing to do with each other. That's some bad science that we were taught years ago. And again, if you go to citations.lowertoxiclife.com, you can find that study. So in Mistreated, his book, he talks about the doctor culture. The doctor culture is, I'm highly educated. I know more than you. Don't question me. Now, he says that in a kind way. So again, I'm not trying to create this air of arrogance around all doctors by any means. But because they've gone through all that they have, there's a tendency on their part to think I'm the expert. And there's a tendency for a lot of patients to think I know nothing and I'm putting everything in your hands. Now, another great book is Undoctored by William Davis. He's the author of Wheat Belly, and he shares some really interesting insights in here, including healthcare mythbusters. And I'm just going to read these for you. And if you go to the blog post listed below, I'll have these all detailed. Healthcare is about healing. Not always, because in today's environment, medical professionals are trained to treat symptoms and not the root metabolic cause. So unless you're seeing a functional nutritional doctor or somebody who's really invested in metabolic health and understanding root causes, you might not get that. Myth number 2, doctors are all knowing. I mean, this comes straight from the doctor. Doctors don't know everything. When you think about it, especially a general practitioner, what they're tasked with knowing and trying to decipher from the short amount of time that they get with you, most of the tests, the blood panels and all of that today are so outdated, it's not even funny. In fact, most medical professionals will tell you, and medical journals, it takes about 17 years for new science to catch up with what's being learned, what's being taught, and what's being practiced. That's crazy. 17 years? Woo. All right. Myth number 3, healthcare costs are high because high quality costs more money. We definitely know that that's not necessarily true. What you pay for your health care does not necessarily correlate to high quality care. Myth number 4, it takes years of education and training to deal with health issues. The reality of it is most chronic disease today, heart issues, obesity and weight issues, arthritis, lupus, so many of these chronic autoimmune conditions as well come down to lifestyle to begin with, even Alzheimer's. They're saying now that where you are at 35 puts you on that trajectory to whether or not you're going to get Alzheimer's. So if you can clean up your lifestyle and your habits, in most cases, within some cases, a few short weeks, a few short months, or maybe even a year, you can reverse many of these dramatic symptoms and change the trajectory of your life and your life expectancy. So keep that in mind, that it doesn't necessarily take years of education and training. What we do know today is that diet and nutrition matters. Ultra-processed foods are not good for us. Seed oils, added sugars, a lot of grains, and trying to think what else. Those would be 3 of the top things that I would factor in. And if you will eliminate those things like processed grains, so if you will eliminate seed oils, added sugars, and especially ultra processed grains like white flour and things like that, you'll eliminate most of your ultra processed foods because they have all that in it. And you will have a dramatic shift in the way you feel, the way you look, your skin quality, your weight, your sleep, and all the rest of it. And then myth number 5, hospitals are havens of caring and healing operated by people looking out for your health and safety. Have you been in a hospital lately? I know I haven't, thankfully, but my mother has. And I'm always just absolutely mortified with nutrition, a Jell-O thing. I mean, just the stuff that they serve on the plate is crazy. They never serve a plate without a dessert. My mom is diabetic. It's not good for her. Yeah, you can take some insulin for that, but what is the cost overall of what all of that combined is doing to her body? It cures the symptom for right now, but that's kind of the end of it. So you have to understand that doctors get paid most often based on procedures, surgeries, prescriptions, and diagnoses. They all have insurance codes, right? You'll see that when you get your statement, there's insurance codes. And overprescribing is huge in today's environment. Again, in this particular book, Dr. William Davis talks about 111,000 people who were prescribed implantable cardioverters, defibrillators, okay? He is a heart doctor. And of those 111,000 people who are prescribed this particular device, 22.5% didn't even need them. The third leading cause of death today is doctor-physician error, or error somewhere within the hospital or the facility. So that's an important thing to remember. So the best thing that you can do is arm yourself to be your own best advocate and ask some questions of your doctor when you show up for the first appointment. Or even if you've been seeing someone for a while, it's never too late to revisit these. Here's an example of some questions that you can ask. See my blog post below where you can actually print these out. What are your thoughts on integrative and functional medicine? And by the way, these are in no particular order. How much emphasis do you personally place on nutrition, diet, and lifestyle habits for my overall health? What are your thoughts on the food pyramid and the standard American diet? Do you have any dietary recommendations for me based on my symptoms? Are you willing to work with me to avoid as many procedures and prescription drugs as possible, assuming that I am willing to make lifestyle changes? And are you open to me asking you questions and sharing things that I've heard through the internet and other sources? I'm not trying to be Dr. Google, and I often reference the Lancet, JAMA, PubMed, and other well-known documented resources and medical journals. And chances are, you don't have to say this part, chances are that's where your doctor is going to go to do their research as well. Think about it. How much post-school education do doctors get? Once they graduate from medical school and do their internship and actually get out there and start really practicing, a large part of it is up to them. Of course, they get updates and all of that, but a lot of it's up to them to continue to do that research. Think about what a doctor's day looks like, okay? At 15 minutes a pop, they see somewhere between 20 and 30 patients a day in many, many cases. That doesn't leave them a whole lot of extra time by the time they're entering codes and doing a lot that's involved. How much time does that give them to really research new medications, new procedures, functional medicine, science that has changed, right? Because science changes. So don't be afraid to be a little bit of a Dr. Google and then work together with your medical professional to figure out what's best for you, and being open to what they may know about what you found and heard, etc. So make sure that you are subscribed to the channel because I'm going to be doing some book reviews on Good Energy. I highly recommend this. Also, Lies I Taught in Medical School. I will go through fully the Dr. Pearl books and then some other ones as well. And of course, more Dr. Mark Hyman. So start with this one by Dr. Mark Hyman, and I'll see you on the next video. And grab my guide over at lowertoxiclife.com.